Dr. Renszel is an academic hospitalist in the hospital internal medicine group at Mayo Clinic Hospital here in Phoenix, Arizona. There she is. Yes. Thank you very much. She's an assistant professor of medicine in the Mayo Clinic Alex School of Medicine. She has her Bachelor's of Arts degree in biochemistry and molecular biology and a Master's of Science in molecular biology as well. Her clinical interests include quality improvement, patient safety, hospital mortality, and undergraduate and graduate medical education. She's been an academic hospitalist at Mayo Clinic for 2 years and completed her chief residency in a Department of Defense-sponsored program specializing in patient safety and quality improvement. She's the incoming third-year internal medicine clerkship director for the Mayo Clinic Alex School of Medicine and the chair of our mortality review subcommittee, and she has an adorable daughter, most importantly. So please help me welcome Dr. Renszel to talk about diabetes.
Thank you, Jen, for that great introduction. I am so honored. This is the third year that I've given this talk about diabetes, but this is the first year that this talk has actually hit a personal note for me. So I wanted to share a personal story with you before I start my talk because I think that brings home why we do medicine. So last year when I gave this talk, I was 28 weeks pregnant. As Jen alluded to, I have a 9.5-month-old daughter named Ava. And that day, actually, ironically, I gave the talk in the morning, and in the afternoon, I went for my 1-hour glucose tolerance test, which I subsequently failed miserably. My blood sugar was 221, 1 hour after my glucose load, and I was diagnosed with gestational diabetes. I have no risk factors. I have no family history. And this kind of rocked my world. I had had no medical problems up until this point in my life. I was 36 years old. And now I was faced with the possibility of this diagnosis affecting my child. So I went home, cried my eyes out for about 24 hours, and then pulled my bootstraps on and said, okay, we gotta do what we gotta do here. So subsequently I ended up having to check my blood sugar 4 times a day. I had to learn how to carb count. I could eat no more than 30 grams of carbs per meal or else my blood sugar would spike over 100, and I felt terrible. And this is all just to tell you guys, once I had the baby and everything was fine, and now I'm fine, and I no longer have diabetes or gestational diabetes. Thank God I was one of the lucky people that didn't go on to develop type 2 diabetes mellitus, which is a risk. I now can look back and reflect on this talk a little bit better. And I realized that we actually don't really take diabetes as seriously in the hospital as we should.